'Cause baby, now we got bad blood. You know it used to be mad love. So take a look what you've done. 'Cause baby, now we got bad blood. Hey! Now we got problems, and I don't think we can solve them. You made a really deep cut, and baby, now we got bad blood. Hey! Did you have to do this? I was thinking that you could be trusted. Did you have to ruin what?
Hi, I'm Gerald. I'm a 67-year-old patient post-op transurethral prostatectomy with continuous bladder irrigation. I'm ordered 2 units of packed red blood cells today. The first unit is hung. Vital signs are a temp of 101.0, pulse of 110, respirations of 30, and a blood pressure of 102/60. I am going to complain of chills, and I'll have a slight erythematous rash on my torso.
Hello there. So Gerald, my shift is over and I'm just going to tell the new oncoming nurse a little bit about what you came in for and what you had done. So this is Gerald Smith. He is a 67-year-old male. He has a history of VPH. He had TURP surgery done on 2/12. He has continuous bladder irrigation with 0.9 normal saline. His vital signs are Q4 hours. He's on 2 liters of O2, fluids running at 50 per hour. His doctor is Dr. Evans. Vital signs are 135/85, 14 respirations, 98.6 temp, and 55 heart rate. His labs, his hemoglobin is 5.5, hematocrit is 16.5. He's ordered 2 units of blood, and his blood is B positive, and he also needs the consent signed for the blood.
All right. Well, thank you so much.
Bye, Rosamund. It was nice meeting you, and good luck with everything.
Thank you.
Hello, sir. How are you?
Good, how are you?
Okay, well, I'm your new nurse from 7 a.m. to 7 p.m. My name is Julie, okay? And as you just witnessed, I got some report from your nurse. The doctor is aware of your situation, and he did order 2 units of blood for you because your hemoglobin levels were lower than what we really wanted.
Yeah, I feel awful.
So yeah, did you ever receive blood before?
No, I've given blood.
Okay. Do you know if you have any kind of reaction to blood products at all?
No.
Okay. All right, well, you do have the order in for the 2 units of blood, okay? So I am going to call the blood bank to verify your information, and we'll go from there, okay?
Thank you.
Did you have any questions for me?
No.
All right, well, let me know. You know the drill. Buzz if you need me, and we'll take care of it.
An RN's role during blood transfusion is 1. Ask client about any allergies or previous blood reactions. 2. Type and cross-match blood. Ensure that the donor's blood and recipient's blood are compatible. 3. Check blood for bubbles, dark color, or cloudiness. 4. Make sure informed consent is signed. 5. ID checks by 2 nurses, healthcare provider's order, hospital ID band, name and number, blood component tag, name and number matched to the client and blood type. Check baseline vitals, including temperature. 6. Start with normal saline. 7. Run blood slowly for the first 15 minutes. 8. Stay with the client for 15 to 30 minutes. 9. Recheck vital signs 15 minutes after the infusion has started. 10. If no adverse effects, increase the rate. 11. Take vitals every hour until completed, then hourly for 3 hours. 12. Ask client to report any itching.
How are you feeling now? Any changes?
No, real weak.
Okay. Are you in any pain?
No.
No, okay. Would you say 0 from 0 to 10? With 0 being no pain and 10 being worse, would you say it's a 0 or?
Yeah, let's go 0.
Okay. Well, I do have your consent, which you do have to sign in order for you to receive the blood. Okay, and you will go ahead and sign it. And there are some associated risk factors with receiving blood. The side effects could be back pain, dark urine, chills, fainting or dizziness, fever, flank pain, which would be like around here, your skin flushing, and it might be a shortness of breath or itching. Since you didn't receive blood before, you don't know if you would have a reaction, but I will be here with you for the first 15 minutes to or even half an hour to see how you're tolerating that blood, okay? All right, did you have any questions?
No, I just hope none of that happens.
Yeah, we will hope. Okay, here's the consent, okay? You can sign right here by the X. And if you have any questions, I'll be more than happy to answer them for you. Very good, okay? I'm gonna go ahead and get that blood for you, okay?
Okay.
All right. Oh, hello.
Hello.
How are you? I am Gerald's nurse. And
No.
what is your relationship to the patient?
No English.
You don't speak English?
No.
Oh, okay. Well, that means that we're gonna have some communication barriers. I'm gonna try to get somebody for you on the phone that speak your language, okay? What language do you speak?
I can.
I can?
Mm-hmm.
Okay, I'm gonna call telephone, and see if you could get somebody, a translator, okay? Okay, because me no speak your language, okay? Okay. Hello, how are you? This is RN Julie. I am the nurse for Mr. Gerald Smith in room 412. He's a patient of Dr. Evans, and he's ordered 2 units of P positive blood, and he already signed the consent. So if that could be sent up here as soon as possible, we'll appreciate it. Okay? Thank you. Bye-bye. Hello again. How are you? Okay, I have Shanna here with me today, and she's gonna do your vitals before we start your blood. And I'm gonna do a quick assessment, okay?
Okay.
All right. You are running at 50 milliliters an hour. That looks good. And your continuous irrigation.
Yeah, I saw there's blood coming out.
That's a normal finding after your surgery. It looks good,
Thank
okay?
goodness.
No problem.
Thought I was gonna die.
No, we won't let you die. But that's why we're here. Okay? I'm just gonna listen to your lungs and your heart sounds, okay?
Okay. Knock yourself out.
You can maybe breathe just a little heavier than normal.
His blood pressure is normal at 124/79. His heart rate's 65, and his SpO2 is good at 98.
Okay, sounds good. Also, we have the blood for Mr. Smith in 412. Okay, so it is his name on it.
Gerald Smith.
Okay, and then it is B positive. Okay, and it's red blood cells.
Okay, and his birthday is 2/13/1952.
Okay.
So we have the correct patient for room 412.
All right, let's go. All right. Can you just confirm your first and last name and your birthday, please?
Gerald Smith, February 13th, 1952.
Okay, we will be giving you 1 unit of blood, B positive. Okay? And I will be with you for the next 15 to 20 minutes. Make sure you have no reaction to it since you don't know if you have any known allergies, okay?
Okay.
Sounds good? All right, let's get moving.
Hi, I need a translator that speaks Akan. I have a patient's wife that needs a translator to understand that her husband will be receiving blood and that the nurses will be in here taking care of him.
Hello? Adiana Yemikno. Okay. Mo man is saying. Ebe saying. Obia no ana no. Yo. Medase.
Blood's infusing now, so I'm gonna start taking vitals on you just to monitor your status. So can you put that under your tongue for me? Your temperature's normal, it's 98.9. And your blood pressure is normal at 121/76. Your heart rate's at 64, and your oxygen's still at 98. We'll be back in to take a couple more vitals to monitor your status.
What's the matter?
I'm itchy.
Uh-oh. Let me see. Oh, he has the rash.
I'm gonna get another
I'm
some
gonna stop the
vitals.
blood.
Why am I so
Run your
itchy?
saline.
Mr. Gerald,
Allergic reactions, mild. Clinical signs are flushing, itching, urticaria, bronchial wheezing. Interventions are stop or slow the transfusion depending on the agency's protocol, notify the primary care provider, and administer antihistamines as ordered. For severe allergic reactions, clinical signs are dyspnea, chest pain, circulatory collapse, cardiac arrest. Interventions are as included. Stop the transfusion. Keep the vein open with a normal saline solution. Notify the primary care provider immediately. Monitor vital signs. Administer CPR if needed. Administer medications or oxygen as ordered.
translator.
Okay. Run the
What's
fluids.
going on?
Shut up, translator.
Can you pull the doctor, please? And let's give him some Benadryl real quick. 25 milligrams.
Help.
Get the doctor, please.
Okay.
I need a translator that speaks Akan that can tell the patient's wife that the patient is having an allergic reaction to the blood and the nurses are
It's
doing
gonna be
everything
okay.
that
We're
they
getting the
can.
doctor, okay? Talk to the telephone, please.
Hello?
Have a seat.
Hello? Adan, my husband went to me home. Okay. Okay.
I increased your
Okay.
oxygen, okay? It should be easier
Okay.
to breathe for
Thank
you.
you.
The doctor will be in shortly, okay?
Mr. Gerald, I'm gonna get some vitals on you. Just keep taking deep breaths. We're gonna bump up your oxygen so you get a little more air. At 4 liters of O2. His heart rate's increased to 110. He's still getting good oxygenation at 97. His temperature is 101.2. And his blood pressure is 104/62. Doctor.
Alright guys, what's going on here?
Yeah, this is Mr. Smith. He was receiving 1 unit of B positive blood, and he had a reaction to it. We stopped the blood immediately and have him on 0.9 saline.
You guys increase his oxygen?
Yes, from 2
What
to
were his
4.
vital signs baseline?
It was 121/.
76. Heart rate was normal, and his SpO2 was normal also.
Alright, let's give him 25 milligrams IV push Benadryl.
Okay.
We'll evaluate his status and hopefully we can restart the blood transfusion again.
Seems to have improved a little. You've slowed your breathing, so we're gonna get some new vitals on you. Okay.
Okay.
His heart rate slowed back down to 70. His oxygen's still good at 97. His temperature's a little elevated still at 99.3. And we'll see what his blood pressure is.
I sure feel a lot better.
Good, your breathing has slowed a lot. Your rashes seem to have gone down a little bit. And your blood pressure is normal at 120/80. So we'll
we'll see what the doctor has to say. Okay?
Patient's status has stabilized, and we're gonna take the tubing and blood back to the blood bank, notify them that a transfusion reaction has occurred. We'll get a new unit going, okay?
All right, sounds good, Doc.
All right.
Thank you.
Hi, can I have a translation that the patient that was having the reaction to the blood is now stable and they have sent the blood down to the blood bank and that they are sending up a new unit of blood for the patient and he will be monitored closely.
Hello? Okay. Yeah. You understand who you? Okay. Hi. Thank you.
Okay, Mr. Smith, your CVI is going to be removed, your catheter will be removed once this starts running clear. Right now it's still draining some blood because you're post-op TERP. So when that starts running clear is when we'll be able to remove that for you, okay?
Okay.
All right. Hi, how are you feeling?
Better.
Better? You look better. Okay,
Yeah.
so we did stabilize your condition. However, you could still have some reaction still within the 24 hours. So keep an eye on your condition as far as your fever, any pain that you might have, any rash, look for those, okay? And we also had the translator tell your wife, so she will also look out for those. But my shift is over, so I'm gonna go ahead and handle you to a really good nurse, and she will take care of you from now on, okay?
Okay.
Did you have any questions for me? No. All right. Okay, so my shift is over, Mr. Smith. It was really a pleasure taking care of you. I'm gonna hand you off to Marissa. She will be your new RN, okay? So I'm gonna give her a little report about your status and what went on today, so she's well informed about that, okay?
Okay.
And this is Marissa. You go
Hi,
ahead.
Gerald. How are you?
Good. How are you?
Okay, so Gerald is a 67-year-old male. His birthday is 2/13/56. He was here. He's on a continuous blood irrigation. He's on 0.9 normal saline, running at 50 milliliters an hour, 2 liters of oxygen. He had 2 units of blood ordered by Dr. Evans, but he had a reaction to it, and doctor did see him, and we stopped the blood and gave him 25 milligrams of Benadryl, and we will give him another unit. And his vitals were within normal range, and he's pretty stable as far as right now. Okay, we will still need to, of course, keep a close eye on him and administering the second unit of the blood. Okay?
How are you feeling right now?
Good.
All right, we're going to continue to monitor you.
And then she's the wife. Her name is Rosemont, and she speaks Ken. It's also called the tree. She did have a panic, of course, for the right reasons when he was having the reaction. So we did find a translator for her. So if the need arises, you could get a translator for her. Okay? All right.
Oh God, fashion. I don't know who you.
Hi, Gerald. I'm Shauna. I'm going to be helping Gulai here with your blood Julie. Why'd you change your name?
She's just like.
Hi, I'm Gerald. I'm a 67-year-old male who is post-op. I forget.
She's with me here today, okay? And she.
I can't. He's looking at me like making me laugh.
Stop! Okay, well, I'm Gerald's nurse. What is your relationship to the patient?
Wife.
You're the wife?
Yes.
Okay. I thought
Oh,
she
she
wasn't
could
supposed to
continue.
ask you before. Mr. Gerald's nurse. What is your relationship to the patient?
Wife.
No, speak English!
Oh.
But you know it used to be mad love. So take a look what you've done. 'Cause baby, now we got bad blood. Now we got problems. And I don't think we can solve them. You made a really deep cut. And baby, now we got bad blood. Band-aids don't fix bullet holes. You say sorry just for show. If you live like that, you live with ghosts. Band-aids